But the idea is really, to me, the arts, everything this program, telling my story as a program has, it's an excuse to me to come together. African dance, it's introduction to African dance, is because I really like African dance. And I took classes for many, many years. When I lived in New York City and also when I moved to Vermont, I went to Burlington, I just love it. And I think also it's a very celebrational culture, the African culture. So it's, to me, it's inspirational. And people really, really liked it, right? And the idea of being physical with your presence, that's not, you're not in a corner, you're not silent, but you just really have to do something. You sort of the practice of stepping up to try something. I think it was a very safe challenge, and that's so it's a great facilitator. The arts can become a very good, like a soothing facilitator versus, but it's really if you put it to the service, right? If I go like, I'm gonna direct you, right? So then it's like, yeah. How do I do that? So, but it's great. It's really, to me, I think it's very empowering, self-empowering, the idea of self-empowerment.
Yeah, like we all just felt extremely awkward, students and inmates alike. So on that level, we kind of connected really quick.
People are leaving. I have a little homework for everybody, talking about our responsibility. I'm the professor. Would you mind putting this up there and letting people take this? It's just a handout for additional reading and additional doing. So we encourage you to take some action. We don't tell you what to do. We make some suggestions, but take some action, even as little action that works for you and feeds your soul. And makes you feel good, because that really makes all the difference. So that's what that handout is about.
I love homework, Ivy. I think that was fantastic. I just want to actually touch upon some of the conversation about what audience members can do. I've been a part of previous panel discussions where we've touched upon policy reform, and one of the things that's come up is that New Hampshire has enacted comprehensive bail reform since this documentary. Which has been a huge step forward. But I'm curious what other ideas that you have for how New Hampshire can improve and try and prevent what Charlotte mentioned about the incarceration of addiction, of how do we advance criminal justice reform to help the women that we saw in this film?
I think a little may have changed since now healthcare, I think, is maybe a little more accessible. So, and I'm not sure if, rehabs are taking this accessible healthcare. So like getting those things to connect might be very helpful. I don't know if New Hampshire's done the ban the box. Have we done that? Like successfully?
Current legislation.
Okay, yeah, so that's kind of really, really important. Once you check that, yes, I'm a felon, they just skip right over it. It doesn't matter if it's, 5, 10, 7, 2 years ago, they don't even look. Those are just a couple off the top of my head.
What's the bill?
SB 100.
SB 100, so keep your eyes up for that, ban the box. Yeah.
Well, thank you so much, and thank you for coming and talking to us. And I think what I was struck by was this sort of pathway to jail for people who have become the victims of addiction and the disease of addiction. And I think we just need to raise the conversation about addiction as a disease and work on prevention and not be in a state where we're having to face treatment when people are incarcerated. And I think the last thing on social policy that I'd like to see is, the counties are responsible for paying for the health care of individuals in jail. And I really don't understand why that is. I think it goes back to 1965 and some Medicaid law. Can we persuade the federal government to lift that so that people keep their insurance when they're in jail, so we can get treatment in jail, but let's get the treatment to people before they have to be inside the walls.
I also, before I hand this to you, want to make sure people realize this movie is 9 years old, and it doesn't paint the New Hampshire judiciary in a really positive light, but so many great things have happened in the last 9 years. There's some really strong leadership in our judiciary, so if that doesn't come up in our conversation, I want you to leave here knowing that some really positive things are happening, like drug court, for example. I don't know if you realize how robust our drug court program is, so if you don't, do some research about that and you'll be pleasantly surprised.
Does Sullivan County have drug court? No, yeah.
Only county in the state that. Are there 10? No, there are 10 counties. There aren't 10. There aren't 10.
Yeah, I think Keene has drug, yeah, that's the only one that I know of in New Hampshire.
I think there are 10 drug courts, but only in 6 counties.
Only 6 counties. But I think we were working on a bill to expand that. That's not correct.
I'm a judge I'm a drug court judge in Hills North, and it's in every county now except for Sullivan County.
Yeah, go for it.
We've got some state funding.
Can we give you the mic so people
Oh,
can
yes,
hear? Do you mind?
Yeah.
This is one of our judges, so she has good information.
So I'm a judge in the Superior Court, as is this woman who's sitting next to me. And we have drug courts now. They were state funded, so we got state legislation, and so there's funding available. Not enough, as there's never enough funding. But it is now, there's a drug court in every county in New Hampshire except for Sullivan County. And doing wonderful work. And while I have the mic, I will say that one of the most powerful things that I think about drug court, and I saw it in this documentary, is that when people establish a human connection with someone else, it not only benefits the person you think you're helping, but it benefits, I think, tenfold the helper. And every time, we just had a graduation in our drug court where 10 people graduated, and people were in tears, more so the people who watched the graduates who had an opportunity to change lives. And so anything that you can do to reach out and create a human connection, small as it might be, it can be very powerful for a population of people who haven't been seen. Saying to somebody, you are valuable, is probably something all of us can do for somebody. And
it's a big part of what changed my life. Like, honestly, I tell Patty that all the time. Learning that little bit of self-worth and value that I did between trails and telling my story, changed everything about my life.
I mean, I think that's the idea of we all need rehabilitation. If we were to be present in life, withholding judgment, and without expectations, not being driven by assumptions and expectations, and to really risk for others. What is the problem to risk? We are very good at risking for money, right? So where is our humanity? And that's what really gets it so, it's truly small. The idea of telling my story, it's a very small idea. There's nothing brilliant about it. It's just very, very grounded. That's all it is. And it's a lot about hanging out. I had no idea what I was doing there. No idea. I never know what I'm doing there. Right? But I think it's important to dare a little bit to be participant in a much more active way and not we are paralyzed, and it's fantastic to hear so many people that really know. I don't know, like all of this and the laws and this and that. I'm all the time just kind of engaging with people, right? So we all have something to do, right? And I think engagement, social engagement is crucial because social abandonment is great, it's huge. And there's a reason why that's happening.
All right, let's take 2 more questions.
Could I say something?
I just wanted to say one thing about the addiction issue. One of the books on the list is Gabor Mate's In the Realm of Hungry Ghosts. He's a doctor in Vancouver who works, set up one of the first clinics, a kind of needle exchange and safe shoot-up area of the clinic. I know they tried that in Burlington, it was rejected. I think that's one of the things that we could work on because again, the reason why is to tell people we will take care of you, and while you're here, we will actually give you information that might, you might be ready to hear at some point. So I think that's one of the things, that's another one of the things, but this, I really recommend this book. It's got he talks physiologically about addiction, but he also talks about the spirituality of addiction, and it's mind-boggling. Sorry, Jane.
That's okay. No, that's great.
I just want to say a couple of things. There was a question on what can we do as a community. One thing you can do is knock on the door of any jail, any prison, and say, how can I help? If you're really good at certain skills, or you can do tutoring, or you can do support groups. Without volunteers in our jails and prisons, this is how I met Patti, right? She knocked on my door and said, hey, what do you think about doing this? The second thing I want to address is it's not just about the incarcerated. When they're with us, we tell them what to wear, what to eat, what time to go to bed. These are the programs you're going to do. This is what you're not going to do. It's the ripple effect in the 35 years that I've been behind the walls of the institution and been through Mother's Day and Father's Day and Christmases. It's the ripple effect it has on the families. It's the kids of the offenders. It's the grandmothers and the grandfathers raising the children so they don't go in the system. And it's those children in school that were there for Mother's Day thinking, how can I get this card that I'm making in school to my mom in prison? So that's another support system that we really need to enhance, because it's the 2 a.m. phone calls that the earaches and what's going on with that child. It's hard on the offender, it's twice as hard on the family that's raising that child or those children. So really we need to keep that in mind and really enhance services for families of the incarcerated, because they don't have a large support system out there financially or not. Yeah, really. Thank you.
I just wanted to comment on the man in the box. As an employer, I am so in favor of that. I work for a business that believes in giving people second chances. I have 6 employees right now who are either currently or formerly lived in the halfway houses from the state prison, and they're excellent employees. There are a lot of businesses that are missing out on some really excellent employees in a state that has the lowest unemployment rate in the country, and we're begging for employees and they're turning people away because they check that box. And I would just encourage the policymakers here and the people in the prison systems to work on building better relationships with prospective employers, so that as people are transitioning out of prison and out of jail, that their employment perspectives are much better, because if they can't find a job, they're going to be back in jail.
Absolutely. One last question? Oh, you got it.
This may have been answered, and I don't know, but does that program still take place? Is that still a Dartmouth class in the theater and everything that still takes place every year?
You want to hear the best part?
Yeah.
I'm a TA and they pay me.
And actually, next fall, Patti and I are going to be teaching, we teach it always in the fall, and Patti teaches Telling My Story on campus during the year at Dartmouth, which is just for the Dartmouth community. But in the fall, we're teaching the academic course, and we're teaching it at a local charter school, the Ledyard Charter School, which is in Lebanon, New Hampshire. If you might know, Lebanon has a very huge kind of opiate addiction problem. And so the children in the charter school are the children of parents who are either addicts or incarcerated or formerly incarcerated. And so we're trying to really move out. It's not that we're abandoning the correctional facility situation, but we're really trying to spread out and get to the children, to the younger people, before they get into a situation like Charlotte.
Well, it's also so excited by this. It's about the invisible walls versus the visible walls, right? Social walls, and I think it's in a way it's easier for us to collaborate with invisible walls, because we'll go inside a correctional facility hall. And I feel very, very nice. I'm a very nice person because I am hugging an inmate, right? We are like that. We're very paternalist and quite self-serving. And I think we need to break through that. I think actually telling my story on campus, the one I run on campus, it's 100% harder than collaborating with inmates or recovering addicts, which is what we've been doing. So that speaks of something, right? It's like, because it's harder. It's like my peer, and to call those walls is very painful. And I understand it, but it's necessary. And those kids are on the streets, and we are judging them by the minute, and we are avoiding them by the minute. And we are isolating them and cornering them so they become invisible in our society. And that is, I mean, I was talking to the teacher, a fantastic teacher, and she was telling me about a visit and to the museum, to the Hood Museum, and somebody was questioning, who are those kids? Right? And she just was showered with questions about those kids, right? And she said to me, they were behaving fine. They're teenagers. And told her they were not misbehaving. It was just a look, right? Just whatever it is. And that is very damaging. And we just don't, it's like, it's a little bit like the idea of a stigma, right? We can identify stigma, but we do that when we kind of justify ourselves. Stigma really destroyed people's lives. And it's the same thing, so how we relate to one another. I'm going to shut up.
I just want to touch on one thing real quick about children. One thing I kind of like to speak about is children and trauma, and how important it is. You know, when I was growing up, I was, you don't share anything. You don't speak unless you're spoken to. Everything is hush hush. And it totally destroyed me. So it's so important to let your children know, like, how important it is to express trauma or to talk about it and to be okay with it and to not make them feel, or so that later on they don't feel different because of something that they went through. They're still, I don't know how to explain it, but I think there's a big lapse with the connection with, mental health disorders and drug addiction and trauma, mental health and addiction, and, it's just a big vicious circle that.
You'll be happy to know we are going to change that.
Yeah.
We are working on that.
So sign me up.
So I am going to have you come and speak as an advocate. So we need to share this movie with as many people as we can, right? So if you have an organization where you can show this movie, contact me. Remember, it's New Hampshire, 4youth.org. You can get my email address from that. We need to get this movie